Mrs. Wright's documents here, and I've been looking over them. It seems that there might be a question about whether her death was caused by malpractice.
Oh, I remember her. She's the woman who came in with indigestion, and after I performed the electrocardiogram on her, she was transported to the hospital by ambulance.
That's correct. And you performed the ECG on her?
Yes, I did. Why?
Well, looking at her charts, it seems that there might be some errors in the documentation.
What types of errors?
Well, as you know, in this office, our policy is to use SOAP notes, and the chief complaint is not here.
Yes, it is. Patient in for exam.
But she wasn't in for exam. She came in because she was having chest discomfort and indigestion.
Well, I'm not the doctor. I wrote what I was told. And she told me that Mrs. Wright called the office saying she wasn't feeling well, and the front desk told her to come in for an exam.
Well, that's not written in her chart.
Why should I have written it? I'm not the one who told her to come in. She came in for an exam.
Well, the subjective information is what the patient tells us. Did you have a chance to talk to her, see how she was feeling, see what type of pain that she was having?
I did. And that's why I got the ECG machine ready, because I knew that's what the physician would want to have done. See, right here. The physician writes that ECG is abnormal, and she's sending her to the hospital. I don't see what the big deal is.
Well, the big deal is that medical charts are documents that can be used in a court of law. So if the information is not written in, it's as if it never happened.
Well, we have the ECG tracing.
I know that we have the tracing, but there's no documentation that you performed the ECG.
Well, give me your pen. I'll write it in right now.
You can't write it in right now. It has to be written in immediately following the procedure, not 3 months after.
Well, does this mean that the malpractice case is going to go against the doctor?
Well, no, it doesn't mean that. We do have other documentation that shows what the physician did during the episode of care. I'm just bringing this to your attention so that it never happens again. If you can't follow these rules, we will have to let you go.
Well, maybe you should go over the procedures for proper documentation so that I'm absolutely clear.
I think that's a great idea.